mic. Can everybody hear me okay? All right, so today I'm going to be talking about exposing psychiatry's secret agenda. And it might be a little controversial, but that's the way that I like to do things. First of all, a little bit about me. I'm going to give you the 2-minute version. Both of my parents died of cancer when I was in my late 20s, so I was really devoted to finding natural remedies and cures for cancer. So even before chiropractic college, I was going down and meeting with the doctors in Mexico and putting together protocols and had a little team that we had formed in Houston. And when I graduated chiropractic college, it was around 1998, and we opened up a cancer clinic. Yes, I know, I was kind of a renegade, and sooner or later, though, we traced the root cause of all disease back to the accumulation of toxins coming in the body. And we were very successful, not only with our cancer program, but with every degenerative disease. To the point where my office got raided by the FDA, I was told I had to stop, and this information can never get out. So that led me to teaching people, because everybody has a self-healing mechanism. We know that. And what we found out with the program that we developed was that everything is in simplicity. Anyone can do this. And it was based on just cleansing the body to reactivate the body's self-healing mechanism. And so that led us to create cleansing programs, et cetera, and then led us to where we are today. But something is dear to my heart that I see that's happening, and all of you see that's happening on a daily basis, and that's the drugging of everybody and our children. And for me, from the time I was 7 to 15, I was in psychiatrist's office practically every week. Those are my memories, because I was labeled as hyperactive. I wasn't really that good in school. I mean, I was a C student, but I didn't like school. I felt they were teaching me the wrong information. So I was one of those wild childs that my parents didn't know what to do with. And so even though I was in psychologist's office every week, they still never told me anything or really helped me out that much. And thank God they didn't put me on medications, because that was in the 70s before it really got bad. So we really are looking at some devastating effects happening right now. So what I want to cover is how to recognize it, what to do about it, and then what is the root cause of mental illness, et cetera, and how you can work with your patients or work with your own life. So there was a big pharma executive at Merck, I think it was the president of Merck about 10 years ago, that had an executive meeting, and he told everybody the first disaster is if we kill people with pharmaceuticals. The second disaster is if we cure people with pharmaceuticals. So, I mean, we all know how that came about, but really the history of pharmaceuticals was starting around, even in the 40s, they were using fluoride-type compounds to reduce aggression and be able to reduce any type of so-called mental illness. But if you think about it, mental illness, does that mean that your mind is ill? Have you ever seen an ill mind? Well, they seem to think that the problem is an ill mind. So the DSM, the Diagnostic and Statistical Manual, was developed by psychiatrists that just sat around a table and decided, okay, someone has a little bit of stress, or someone has obsessive compulsive, or someone has depression, or bipolar, or something, some form of symptom. Let's put together, with the help of pharmaceutical companies, a way that we can create new customers from ages 1 to life. And the strange thing is they're blaming it on chemical imbalance, but there's no physical test, blood, urine, x-ray, or anything that can verify mental illness. And the strange thing is, it is a chemical imbalance going on in the brain, but it's actually the chemicals that you're putting in the body that's causing it, which they're not addressing the root cause of that. So just to give you some facts, psychiatric drugs kill an estimated 3,000 people every month, 100 million people worldwide. All those school shooters out there, most of them are on psychotropic drugs. Fluoride is actually one of the main components in psychotropic drugs, and there's 8 million children on ADHD medication, 20 million on some type of psychiatric drug out there. This is the next generation. This is what we have to deal with, really. What I want to do now is just show you a quick video and let you know a little bit how big this program is that the pharmaceuticals are working on.
Matthew was a very loved child. He was an 18-year-old American boy like everybody else in this country.
Normal boy. When he was born, just the cutest little baby with big brown eyes.
He was a handsome little boy, and he was very happy all the time.
He was such a free spirit. He was so happy all the time, and he had a smile to die for.
I remember Matt's smile, boy, I'll tell you something.
He was a charmer. Yeah, those eyes of his could probably get him in a lot of trouble.
He was always involved, you know, he likes to be involved in sports.
We used to play basketball, paintball. And
he was always a scrapper, though. That's one thing we liked about him. If you picked on him, he'd pick on your back.
Someone to always talk to, you know, personal relationships, someone to depend on.
He was a great person, lots of fun.
I miss him. I miss him every day of my life.
We called him Matthew, we called him Matt. The kids, the girls a lot called him Matty, you know, but he was my Matt. And he loved to fool around with the kids and wrestle with the boys, and he and Annie were very, very close because they were the closest in age, and those two, they were like two peas in a pod. But unfortunately, apparently he was having trouble sleeping, and he was having bad dreams and waking up and starting to have like panic attacks. That's when I said to him, you know, Matt, maybe it would be helpful if you talked to somebody outside of the family, you know, like, would you want to do that? So I made an appointment with him. So we go in there, and she sits down with us, and after no more than 15 minutes of talking with Matthew and asking some questions, she gives us samples of Lexapro. So I said, what about side effects? I said, you know, what should we expect from something like this? And she says, well, you know, they're very well tolerated. And she said, you know, they could have like headache or nausea or maybe some insomnia. So we went home with our sample pack of Lexapro, and at that point, he stopped wanting to talk. He seemed to be withdrawing more. This was weird behavior for him. Well, A lot was happening at this time also, and he was graduating from high school. Of course, the big plan, the kids always, they go to Senior Beach Week. He didn't want to go. He wanted to go visit his brother. And off he went. The day that he was supposed to be coming home, it was around 1 o'clock. I hadn't heard from him yet. He was supposed to call me when he finally left. Later on, I guess it was after I got off work, I called, and he didn't answer. But a little while later, he called me back, and he said, he said he was almost to North Carolina. It was about 11:30, and I called. He said, I'm fine, I just passed Roanoke. I woke up at around 2:30, kind of jumped up at the clock, and realized he should have been home an hour ago. So I called the cell phone and went straight to voicemail. I kept calling and calling. I'm like, Matthew, answer the friggin' phone. I was like so upset. Fell asleep, woke up again. It was about 6 o'clock in the morning. He still wasn't home. I didn't know what to do. I started getting ready for work. Went to work. I could hardly function. I went, told my boss I have to go home. Get in the door, phone's ringing. And there's this man on the other end, and he said, I'm looking for the family of Matthew Stubing. I said, this is his mother. Who's this? And he said, I'm calling about the jumping. Our world blew apart. We couldn't imagine that this had happened. We couldn't understand because this just wasn't Matthew. None of this was Matthew. I mean, it was like, made no sense. It made no sense.
So this is actually what's happening. There's one child every single week committing suicide right now. There's such an attack on the children. 17 million children worldwide are being prescribed psychiatric drugs. And the sad part is, as you know, the normal time spent in a physician's office now is less than 7 minutes. But they're being prescribed these drugs in less than 15 minutes. I mean, without any type of diagnostic material. Children as young as 4 have attempted suicide while influenced by these drugs, and 5-year-olds have actually committed suicide. The 5 and younger age group are the fastest growing segment of the non-adult population prescribed antidepressants. I mean, that's just crazy. I can't believe you would actually give medications to children when their mind is growing and when they need to be able to experience life around them. Antidepressant use is up 580% just between 1995 and 1999. And my question is, how many geniuses are being lost every single day because of this? When is the last time that we've had an Einstein or a Tesla or some genius out there? I mean, what happens to kids? As soon as they're born pure, in a pure state. And then they get vaccinated, which automatically messes with their mind. And then all of the toxins and the chemicals they're exposed to. Most geniuses, Einstein, Lincoln, Winston Churchill, Tesla, all of them would have been diagnosed with learning disabilities. Einstein didn't even fully, comprehend and read the English language until he was 9. I mean, each one of the main geniuses out there all really had, if you look at the history books, some form of what would be labeled today as a learning disability. So here's another short video I'd like to show everybody.
In just these past few months, I have found that we are in the middle of an epidemic of the psychiatric drugging of our children. Across the world, there are 20 million children on some type of psychiatric drug. 20 million. And as shocking as it might seem, psychiatrists at a recent conference even admitted that they are diagnosing children at younger and younger ages.
From your personal experience, what's the earliest age that you could diagnose a child with a mental disorder?
It depends. Some disorders start in early childhood, some in adolescence, some in adulthood.
It's a very, very complicated question.
Earliest isn't really a criterion.
End of junior school, going towards high school.
13, 14.
Probably 6 and over.
6 and 7.
The age of 6.
5, 6, 8, 5.
5 years?
3, 4, 5, 6 years of age.
Probably 4 or 5.
4 or 5.
4 or 5.
When you look at a kid who's 4 years old and trying to diagnose him with ADD, how can you tell it's not just because they're 4 years old?
4 years, 3 years.
Very early. 2, 3, 4.
2 or 3 years.
The age of 2 or 3.
2, 3.
Toddler.
Before 18 months.
They can actually see signs as early as the age of 1.
It's a few months probably.
Babies.
The newborn.
Newborns.
In the uterus.
Rebirth, that's what we wish. Psychological problems start even when you are in the mother's womb.
It's disgusting that anyone would even think of giving a mind-altering drug to a young child with a developing brain. But what about the children drugged before they are even born?
So that's pretty sick, huh? I mean, before they're even born, diagnosing mental illness. It's all part of the big plan to have everybody on some form of mental illness or some form of medication. So there's really 3 types or categories which you need to look out for. One is ADHD medication, and I know everybody's familiar with that. That's going to be a Ritalin, Adderall, methylene, and the other ones. But really what you need to look at is the ADHD medication side effects. You know that just with one medication you have side effects, but a lot of times these children and adults start with one medication which leads to another one and leads to another one. So nervousness, increased risk of sudden death, increased blood pressure, heart rate, weight loss, circulation problems. You know, ADHD medication is basically legal speed. So all of the addictive personality traits you're going to get with that as well. Then you look at the antidepressant category, which actually ADHD medication can cause depression. And then they're back in for Lexapro, Prozac, Paxil. And you still haven't addressed the root cause of why they have mental illness to begin with, which is all the chemicals and toxins. All you're doing is putting more chemicals and toxins into their system. Antidepressant side effects, suicide, nervousness, bipolar, anxiety, weight gain, violence. You know, there's kids that are actually slaughtering the family pets, insomnia, increased risk of suicide. Then the third category is the antipsychotics, where you have the Seroquel, the Zyprexa, the Abilify, which all of these usually, like I said, have fluoride-containing compounds in them, but now you have antipsychotic medications which actually cause psychotic and manic behavior, tremors, heart problems, increased risk of sudden death again. These 3 categories really need to be looked at. 91% of all the children that go to the psychiatrist leave with a prescription. And they actually have in the DSM, which the DSM-5 now is over 400 different mental disorders, that if you leave the psychiatrist's office without a prescription, there's a diagnosis of mental illness just for leaving the psychiatrist's office without a prescription. So, you know, this is all big money for the drug companies. $20 million a year is what the CEOs get. 100 Xanax, for example, costs 2.5 cents to manufacture and are sold for 136. That's a profit of 500,000%. And the sad thing is that the smart children are the ones that are being targeted. I mean, because they're the ones that are bored in school. I talk to parents all the time that actually did not vaccinate, that feed their children organic diets, and they're above and beyond all the other children in the class. And so, of course, they're going to be labeled as a learning disability because they already know the information. Their brain is actually working. They're smarter. And so school becomes boring for them. But not only are they attacking children, but also pregnant moms right now. 1 in 6 pregnant women are diagnosed with depressive disorder and given and prescribed antidepressants. They're taking antidepressants when they go into early labor. I don't know how they're doing it, but apparently there's some ultrasound that can diagnose bipolar disorder in the womb now. So, and then breastfeeding as well. So this is one last video that I want to show you guys, and then we'll move on to the solutions on what you can do to eliminate this.
Friends get to visit their brothers at college, and they have their little brothers on speed dial. And I have to visit mine in a cemetery because someone made a decision that this information wasn't going to make them money. Is what it came down to. Or it wouldn't get their drug approved. So I visit my brother in a cemetery on his birthday, and on my birthday, and on Christmas, and any random day of the week. I go there. But I won't see him get married, and I won't see him have kids. And he won't be there for me when I do those things. Because he's not here.
The reason I'm showing that is because not only are they saying the kid is affected, but it affects the whole family. And when you have the one person on psychotropic drugs or a kid on psychotropic drugs, it's not just that. There's so many other things that the whole family, grandparents, everybody are affected by that. So I started looking into more of how they're pushing this, and the schools are actually pushing drugs right now. They're sending forms home for the parents to fill out. Do you get nervous before a test? Of course. I mean, who doesn't? You know, do you experience any depressive-like symptoms from time to time? So the doctor actually, who wrote the screenings, most of the screenings for the schools, actually came out and said that they were wrong 84% of the time. And drugs are even being prescribed if you're just nervous before a test. So hopefully that will change. So what is actually causing all the mental illness? I mean, that's really what we need to look at. And it's not that hard to figure out, because as chiropractors, we do an extended history, which I think is one of the lost arts out there of really finding out what's going on with your patients. Because you can find out everything, you know, asking them about their job environment, asking them about their dietary habits, what do they drink, are they on artificial sweeteners? All mental disorders, there's really, in my mind, no such thing as a mental disorder. None of them exist. That means all 400 and something mental disorders in the DSM are non-existent. And you can do the same thing, because you can look at every single chemical toxin that affects the brain: fluoride, toxic halogens, phthalates, endocrine disrupting chemicals, other prescription medications, GMO foods, gluten has effects on the mind. I mean, if you factor in all of the toxic chemicals that people are exposed to on a daily basis, and kids are exposed to on a daily basis, that's the cause of the mental illness, not some weird genetic chemical imbalance or something. So, thank you. So everything is in simplicity, you know. It's really addressing the root cause, and it's the same thing we did with every single disease, whether it was cancer or anything else, is taking away. Let's say the body's taking in 1 million toxins every single day, but it can only get rid of 500,000 toxins on a daily basis, because People aren't drinking enough water. You're not urinating enough. You're not defecating enough. The medical profession says 2 bowel movements a week is normal. I mean, crazy. You're not breathing enough. You're not respirating. You're not sweating enough. So how we do it is just going back to simplicity. I mean, where are all of the chemicals that are going to affect the brain and cause so-called mental illness entering the body? They're all entering through the intestinal tract, through the foods and beverages and water and all the other stuff. So step 1 is 70% of your immune system's in your gut. You know that. Most people's gut is imbalanced. First thing we always do with cleansing is cleansing the gut tissue, changing up the diet, eating more organically. And there's a lot of probiotics out there. The ones that I've used that seem to work really good. I use oxy powder to cleanse the intestines, and then I use Lateral Flora, Del Pro, and Primal Defense Ultra. But I'm not saying these are everybody needs to use these. But anyway, just what I'm saying is fix the gut. You'd be amazed at how many children, as a matter of fact, the American Autism Association uses our cleansing program for children with autism because it works so good. Jenny McCarthy actually mentioned oxy powder in her book because once the gut becomes healthy, all those brain-altering chemicals are not going to be affecting and altering the neurotransmitters and causing any type of mental illness. And that's step 2, which you can kind of do at step 1, is cleaning up the air and the water in your home, eating organic food, avoiding the gluten, avoiding all the GMOs, avoid the toxic drinks, avoiding all the processed food, microwaved food, taking away everything that's going to cause the mental illness to begin with. And then step 3 is really creating an environment for your children or for yourself. I mean, we're talking about children up here mostly, but I mean, pretty much, I would say 90% of the adults that contact us have been on multiple psychotropic drugs for a long time. So it's about changing one thing at a time. But reducing stress and anxiety is probably one of the hardest things to do living in this world with all the negativity coming on TV. And so what I recommend is meditation. Actually is one of the fastest ways to move your from a sympathetic state into a parasympathetic state. Like sitting down 9 deep breaths. And actually people usually eat their food in a sympathetic state because they eat on the run, they eat in the car, they eat watching TV. And what happens when your digestive system is in a sympathetic state? You're not going to digest your food properly. People aren't chewing their food until it's a liquid before they swallow it either. So getting a hobby, learning about yourself is one of the best ways to reduce stress and anxiety. Now, like I said earlier, everybody has a self-healing mechanism, and I didn't realize how powerful that was because even when we had our cancer and degenerative disease clinic, I still had like 260 different types of supplements in my cabinet from all over the world, and we would take everybody through a cleansing process, and then we would, help them out with the different types of supplements. But what happened over time is just by cleansing the body, people would start to get better. And different types of diseases and conditions would go away. And that would usually be an intestinal cleanse, multiple liver and gallbladder cleanses, kidney cleanse, parasite cleanse. I mean, parasites are everywhere. And the parasites are altering because they're eating and taking all of your nutrients and then secreting toxic substances back into your body, like isopropyl alcohol, formalin, formaldehyde. So once you clean the bowel and the liver and the kidneys, and you clean all the parasites out, and then you clean all the chemicals and heavy metals out of the body, then the body's self-healing mechanism starts to reactivate itself again, and the healing process begins. Of course, with chiropractic care as well, because you have to free up those nerve pathways to all the organs so the body can properly detoxify itself. What I've found is that even kids, I didn't know how important the liver actually was until 15 years of looking at people with all different types of diseases and figuring out that pretty much even kids now with obesity, the liver is associated. Everybody's liver is pretty much toxic because the liver is overworked. I mean, how can the liver detoxify so many chemicals on a daily basis that we're exposing ourselves to? But step 4, while you're working on getting the body clean, while you're working on reactivating the body's self-healing mechanism, some of the things that I've used that I think work the best are iodine, a detoxified nascent iodine, which I think pretty much everybody needs. I mean, that's why you're seeing so many thyroid conditions because of all the estrogens and the endocrine disrupting chemicals and the other toxic bromine, chlorine, fluoride. Rhodiola is a good herb that's kind of an adaptogen that seems to work to help balance somebody's emotional states. Kanna, mucuna, passion flower, saffron extract, and bacopa. So those are like some natural things you can do, but the biggest thing is that you start seeing all the mental disorders go away as soon as you start healing the body, healing the gut, and reactivating the body's self-healing mechanism. So hopefully everybody will. I have a book called The Green Body Cleanse, which actually explains all that and explains the protocols that we've used over the last 15 years. And it's easy to implement into your practice and implement into your own lives because it's not eliminate everything, it's replace everything. So it's not here's the problem, it's here's the situation and here's the solution to the situation. Like replace your table salt with Himalayan crystal salt. You know, get off the artificial sweeteners and replace them with this. Eat organic, don't eat GMO food. And education, because really we should be educating the patient because the doctor is really within ourselves. And if we educate people how to listen to their body, listen to their symptoms, then we are really a teacher and we're helping society and those people get results and they can pass on that information. So thank you. I appreciate your time today and wish you guys the best. What's up?